Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Thank you for taking the time to listen to our biweekly message. Unfortunately, the situation that I described in my message 2 weeks ago has not substantially changed. My heart goes out to families with sick children, others who are unwell, and healthcare workers, and many others who are struggling to care for them. For others, I know it can be hard to continue to hear about the pandemic, RSV, flu, and other viruses, and our overwhelmed healthcare infrastructure, and not feel how this impacts your life and well being. But I'm urging you to please take heart and do your best to help your loved ones and the community. I hope you, like me, are constantly searching for ways to decrease the pressure on our hospitals and emergency rooms so those who are seeking care and needing care most, including the elderly and now our young children, can get the care they need. Specifically, I can share with you today some updates on the three viruses that are contributing to this burden of illness in the community right now. Regarding COVID, things are stable. Our York Region COVID wastewater may be trending upward somewhat, but our institutional outbreaks and hospitalizations are stable. In particular, we're encouraged by the fact that some of our long-term care facilities have high COVID and influenza vaccination rates, but unfortunately, other facilities lag somewhat behind. We encourage everyone in long-term care, or with family there, or who works there, to ensure that they're protected with a bivalent vaccine and the influenza vaccine. When long-term care or any congregate setting has high vaccine coverage, not only are people not getting sick or very sick, but outbreak measures that impact mental health are not needed. Our influenza trends are indeed very concerning, with our trajectory already exceeding any recent influenza season in memory, both in terms of magnitude, the height of the influenza in the community, and the timing, which is much earlier than usual. We may be seeing indications that influenza may be peaking, but it will take a few more weeks to confirm this. Fortunately, this year's flu vaccine is a good match, and each and every person of any age who gets the flu vaccine this season is making a difference. RSV, or respiratory syncytial virus, is circulating at unprecedented levels and mainly causing severe illness in young children. Our emergency rooms and inpatient pediatrics are absolutely overwhelmed with ill and severely ill children. Older adults may also become seriously ill with RSV, but there's some good news on that front, with Health Canada recently reviewing an RSV vaccine candidate for seniors. We are excited that we've partnered with researchers to look into flu and RSV wastewater monitoring, as well as the COVID wastewater monitoring we're already doing. This is an important tool for today and for the future, and we look forward to bringing you updates using that data shortly. For now, I strongly encourage you to think about those impacted by these viruses, mainly the children in our communities right now, and to consider wearing a mask when you're in a crowded or confined public setting. York Region Public Health continues to follow the provincial recommendations on masking. It's a very reasonable and easy way to stop the spread of these and other viruses. We trust you'll continue to consider others and protect yourself and your loved ones. We are approaching a very social time of year for many York Region residents with holiday gatherings. When considering what else you can do this season to keep yourself and others safe, please take a moment to assess whether or not you have cold or flu symptoms before you gather. Whether or not you have COVID-19 or the flu or RSV or any cold virus, what may appear as a mild cold for one person can lead to a severe respiratory infection in another person, and especially for those who are very young or other vulnerable groups. Hopefully, your family and friends will understand if you need to stay home and reschedule when you're feeling better. Of course, before you gather, almost every York Region resident should have a bivalent COVID vaccine dose and the influenza vaccination this season. You can receive these at your local pharmacy or at our York Region public health clinics. Now is the time to get your shot to allow for full immunity to develop before the busy holiday season. We have many clinics available for you. You can visit york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675 to book either or both vaccines. Remember to follow all other layers of protection as well. Practice good hand hygiene, remain distant whenever possible, and if you choose not to wear a mask, please have one with you in case you find yourself in a crowded place or in close contact with someone vulnerable. The approaching holiday season is usually peak time for viruses to spread, so let's get ahead of this and stay safe so we can enjoy celebrating with our families.